4 new facts about COVID-19 that you won't hear from the mainstream media or from your public health officials. Since they won't report the latest science and data to you, I will. New data from Amazon decimates the narrative that government-mandated lockdowns are necessary to stop COVID-19. According to Amazon, 19,816 of their US-based employees have either tested positive for COVID-19 or been presumed positive. Now, Amazon has a total of 1.3 million US employees, so 19,816 is only 1.44% of their total US workforce. Compare that to the 2.18% of Americans in general who have been infected with COVID-19, that according to the CDC. That means people in the US who have been locked down are 51.3% more likely to contract COVID-19 than the Amazon workers who have been working and interacting with a wide variety of people in a wide variety of places. According to Dr. Mike Ryan, who serves as the executive director of the World Health Organization's Health Emergency Program, he says the WHO's best guess is that 10% of the world's population may have been infected with the COVID-19 virus. So let's do the math here. 10% of the world's population would be 750 million people. According to the WHO, approximately 1 million people total have died worldwide from COVID-19. So if 750 million were infected and 1 million of them died, that's an infection fatality rate of 0.13%. Now, according to CDC data over the past 10 years, the infection fatality rate for the seasonal flu here in the United States is also 0.13%. According to data collected in states across the country since the onset of the COVID-19 outbreak in the United States, ever since the CDC changed their tune and told people to wear masks, no major outbreaks of the COVID-19 virus have been tied to in-person voting. This is simply the fact of the matter, the empirical evidence. Starting with the primary elections in Wisconsin in April, no COVID outbreaks have been traced to in-person voting. Meanwhile, according to top German virologist Hendrik Streeck, it's time for the COVID restrictions to end. Streeck says, and I quote, "We are dealing with a serious virus, but we must no longer over-dramatize this virus." He says this virus is fatal for only a few, just like many other viruses. Streeck says excess mortality in Germany, for example, was seen much more clearly during the 2017 flu season and the heat wave of 2018 compared to the current COVID-19 outbreak. Streeck says, and I quote, "The increasing knowledge of science should give courage. There's almost no transmission via objects. There are also few risks of infection in normal everyday business, for example, in retail. Many infections were completely without symptoms. Only 5% of those infected would need clinical care at all, far less need intensive medical care." End quote. Since public health officials, elected Democrats, and the mainstream media refuse to report any of this to you, I will.